$4,709. In a 2019 report by Peterson KFF Health System Tracker, it states that that's the average annual health spending for women 19 to 34 years old. That is more than half of UCO's average yearly tuition. That's a serious dent in the pockets of people with low income, especially, for example, university students. It is more than likely in many circumstances that people would end up using that money for something other than healthcare at the end of the day, such as student loan payments, credit card, rent, child support, or even food. That's where Planned Parenthood steps in as a valuable asset to the community that offers affordable or even free medical care, especially to those that are of lower income brackets. And while abortion is a service offered by Planned Parenthood, and it does exist, there's a wide range of beliefs held on the topic, and it's not going to be the focus of our discussion today. And it's just a small portion of what Planned Parenthood has to offer. The focus of our discussion today is that lower income people have a lack of access to preventative health care measures and just general wellness upkeep. The issue with low income access to healthcare is that it has really negative effects that can lead to a lower quality of life or a shorter lifespan on average. The American Academy of Family Physicians stated that poor nutrition and elevated stress levels can be factored in, associated with lasting effects on children beginning before birth or continuing afterwards into their regular lives. So if a person's born into a low income or poverty levels, they're immediately sent into a higher risk level and a higher risk lifestyle based on lack of adequate access and just a general lack of understanding to what the healthcare they're needing is, because they've never had access to it. Health literacy is the person's understanding of their healthcare information. It helps them make appropriate decisions and medical and health-based choices for themselves. And according to the Milken Institute, 77 million Americans have difficulty understanding their medical care or just obtaining health care at all because their health care literacy is so inadequate. So when a person's health literacy is subpar, they're directly suffering because they can't get the care they understand or need. Luckily, Planned Parenthood offers not only medical services, but also health education to help fix this issue with health literacy. The program offers a well-rounded approach to helping the community at low costs. Planned Parenthood actually offers access to a wide variety of healthcare needs, especially for low-income patients. They offer primary care, contraception, STI testing and treatment, pregnancy testing and care, general pelvic exams, cancer screenings, and patient education. While many of the services can seem a bit gender specific, Planned Parenthood happily treats anybody that walks in the door and suits them to their individual needs. And according to a 2019 Planned Parenthood data document, almost 75% of patients with incomes that were at or below 150% of the federal poverty levels, and at least 60% of Planned Parenthood patients access their medical care through the Medicaid program or Title X family planning program. That really emphasizes the fact that Planned Parenthood is a resource that is especially crucial to those that are in dire financial need. Planned Parenthood being a crucial resource also just sort of goes to show the benefits of what achieving success for them could do for the community. There are physical and financial benefits to affordable health care, specifically Planned Parenthood, for those that are lower on the earning spectrum. In a 2017 report by the Congressional Budget Office, an estimated 360,000 patients could lose access to any medical care if Medicaid or Medicare was denied at Planned Parenthood. The services that Planned Parenthood provide for lower income patients is critical to provide any sort of medical care to that demographic that we're concerned with, including, but not limited to, students such as yourselves. By donating to a public service such as Planned Parenthood, not only are you doing a service to the community, but all those lower income neighbors that you have that need that help, you're also helping them. And you're also ensuring that the program remains prosperous and functional in just the possibility that you might need them to. By keeping Planned Parenthood funded, it's a benefit to everyone. To conclude, if everyone in our speech class donated just $15 to Planned Parenthood today, you might be able to save a life possibly with an early breast cancer screening that they could receive for free. Or, if you have a preference to where that donation would go, Planned Parenthood actually allows for specific donations to be made, put towards a certain service that the donor would like attributed to, whether it's cancer screenings, health education, or simply just annual primary exams. Every dollar counts towards a service that someone else can't afford, and they might not know that they need yet, and maybe you might even need it. So thank you so much.